Hi, my name's Dr. Ross Hauser. Welcome to Caring Medical Florida. We're in our studio in Fort Myers, Florida. Again, I'm just got a wonderful person that we're going to talk to today, Jonathan, and his story is amazing. You guys have heard me say on other videos about how neck instability, it can screw up the fluid flow into and out of the brain. And then obviously if it screws up the fluid flow into and out of the brain, it could cause brain disorders and all kinds of symptoms. Obviously it could cause anxiety, which a lot of people have, but also brain fog and even traditional psychological disorders like bipolar or obsessive compulsive disorder. And then if a person's neck structure gets broken, it can start affecting the vagus nerve. And the question is always that I get is, doctor, well, is it reversible? Is it reversible? Like, I know the MRI showed some brain degeneration, or the scan showed some vagus nerve degeneration. Is it reversible? And it's unbelievable how much regenerative capacity the human body has if you correct the underlying structural problem. So you have to correct the underlying structural problem, which of course, we're not totally done, right, Jonathan? But man, your story, it's like dramatic, huh?
Yeah, it's been wild. I've been dealing with neck pain and chronic inflammation for about a decade now, and I've tried everything, always chosen to avoid surgery, but my initial injury, I got hit in the head by a boom of a sailboat and suffered a pretty massive concussion and whiplash with that. And so my first diagnosis, I fractured my C6 vertebrae, and it's, been such a journey. I actually, after that injury, I developed this thing called post-concussion syndrome, and was going to all sorts of doctors on the East Coast, specifically in Boston. Many of them, professors at Harvard who see this all the time, and essentially their approach was like, we don't really know why you're going through this, but we're gonna throw medication at you and maybe something will stick, but you'll likely be dealing with this the rest of your life. And so when you're 16 years old and you hear that, it's pretty depressing. And me being just kind of a positive person, I'm like, let's try something else and let's try to see if we can fix this. And I think, I have been fortunate to be able to approach different people and approach different doctors and get second opinions, third opinions, and some things have worked temporarily and been helpful. And I've been able to go to school. I graduated high school, and my doctors say it's pretty unlikely you might not be able to graduate high school. My senior year, I actually missed 80 days of school because of the chronic pain I was dealing with. And thankfully, I had a lot of people lobbying on my behalf, and I got my degree. I ended up taking a gap year to just kind of take some space to recover mentally and see what I really wanted out of life. And during that time, I actually, started to heal a little bit. And I think a lot of it was attributed to just my mindset of positivity and like, let's get moving and try to find something different. And I was fortunate, I traveled through Europe by myself when I was 18. And then spent 3 months sailing in the Caribbean and saw what life could be. And life is challenging for a lot of people, but there's always positive things you can find. And I ended up going to college. I spent 4 years at Loyola Marymount University. I graduated with a degree in entrepreneurship and New World Marketing and Branding. And I actually, I got straight A's in college, graduated with honors. But through that time, studying, you're looking down at books, you're carrying heavy textbooks. Like, my neck pain was, getting worse and worse over the years, and I spent, large sums of money getting massages and going to chiropractors and seeing other doctors every week, and only unfortunately kept getting worse because I'm getting over manipulated. And the next step, some of my doctors are saying, you're gonna have to get surgery. And obviously neck surgery doesn't have a high success rate, can often make it worse. And I've been fortunate to to work with various athletes and see different approaches to new medicine, or at least cutting edge medicine. And I've looked around the world and around the country to find different doctors that do prolotherapy or do stem cells. And you know, my dad actually found you, and he sent me a video clip. He's like, hey, let's try this. And about 6 months ago, you know, we started the process with Caring Medical. And you know, I was in a pretty dark place. And you know, when you have a neck injury and it's specifically upper vertical, like C1, C2 issues, it really does affect blood flow to the brain. And I've dealt with depression, I've dealt with anxiety, I've dealt with, you know, many other, you know, just mental illnesses associated with chronic pain and you know, chronic sickness. And you know, my first treatment with you has been you know, really comprehensive, and I was very impressed with the way you approach things. And I've done stem cells and various growth factor injections in the past, but I hadn't really had a full perspective of what that actually does, what it means. And you know, just sitting with you for a couple hours, getting an overview of what's possible, and realizing that, you know, if you can fix the blood flow, if you can fix the ligament laxity, your brain can kind of heal itself. And so since I've been doing this treatment, you know, the first treatment, I definitely felt some immediate results. The second treatment, I was like, wow, like, you know, I actually don't have neck pain. And like, obviously want to continue to make sure this gets fixed fully. And, you know, there's other things you do with weights, curve correction and exercises and things like that. And, you know, over these past 6 months and multiple injection sets, I now have no neck pain. I don't know if my neck is completely fixed, but it is, you know, it's really a miracle, and my life has changed in a major way. I work 7 days a week, and I've never been more productive. I've never been happier, to be honest. And you know, when you take that pain away, you know, it feels like you have a knife stabbed in your neck, and like that's where your brain is, and you know, it affects everything. So my cognition has been, you know, greatly improved. I feel like my baseline, you know, pre-injury, I feel like I'm back there, but you know, now even better.
Oh, that's
And
great.
yeah, it's been wild. You know, I'm a creative individual, and I think,
Why don't you explain what you do?
yeah, so I'm a photographer. I do creative consulting, and I've been really fortunate. I lived in Los Angeles. I went to school at Loyola Marymount. It's a small private school in Los Angeles, and I, you know, had a really wonderful life out there, but always, you know, had some setbacks with the pain that I was dealing with. And you know, the workload can get pretty intense sometimes, and when I get stressed out or I have emotional problems in my life or whatever, you know, it exacerbates the pain quite a bit. And you know, since working with you, I've been able to eliminate that pain, which, you know, opens up a range of possibilities.
Yeah.
And it's really just been, yeah, I mean, it's been a miracle. It's been phenomenal. And you know, there's always more work you can do, and you know, nothing's ever perfect, but I've had a phenomenal experience working with your team.
Thank you so much.
And it's yeah, it's just been a wonderful education hearing, you know, what's possible. And I think, you know, for me, because I've had, you know, 8 documented concussions, I've probably hit my head at least 12, 15 times. And when you're so sensitive after a first concussion, you know, if you get a second one, it becomes much worse. And it's a scary thought when you're so young and you have ambition, to be told that, you know, you may never recover from this, your brain's never going to heal. But you know, my I guess North Star was, I worked with a amazing neuroscientist, and she was like, there's this theory called neuroplasticity, and you know, your brain can change over time. It doesn't matter if you're a kid or you're 80 years old. If you can retrain your brain and rewire your brain to essentially learn new things, or especially if you can get more blood flow to the brain and the body can heal itself. And I think, oftentimes when people go through chronic illness, it's such a debilitating thing. You have a level of depression no matter what, because it's always in the back of your mind. And if you look at studies of people who are depressed and people who are normal, you look at their brain activity, significantly less activity in those who are depressed. And that affects everything from your mood, your energy, your cognition. And if you can kind of shift that, through medical intervention, but also through just having faith and positivity, whatever that means to you, the brain and the body are amazing, and you really can heal yourself through treatment and through discipline and mindset. And it's been, such a phenomenal thing finding you guys. I've looked all around the country and even around the world. There are different people that do this, and it's really just been a blessing.
Not to put you on the spot, but how people get a bunch of diagnoses. So I wouldn't, if you're able to, and it doesn't mean, like, for instance, I'll give you an example. So say a doctor gave you the diagnosis, let's say, of bipolar.
Yeah.
And as well as I do, and I'm not saying all bipolar is, neck instability causing bipolar, but people have to realize, like, if, you have a car accident or you have 6 head traumas or you're a football player and then you get diagnosed with bipolar, you might have structural bipolar. Like, in other words, you have a neck structural problem, which I call cervical dystructure, which you had. And then that, because it inhibits the fluid flow into and out of the brain, then you get increased brain pressure, which then, of course, causes increased eye pressure. So if you wouldn't mind just maybe going through, just for people who might watch this, like, all the different diagnoses that you've had. Like psychological diagnoses.
Yeah, absolutely. So my first diagnosis was I had severe post-concussion syndrome, and that's a wide ranging of things. But essentially what that means is you get a concussion, and when you have a concussion, it's supposed to take about 3 to 4 weeks, maybe a few months to recover from the cognitive effects from that. For me, it was about 13 months of feeling like I had a concussion, operating like I had a concussion. I would walk into a grocery store and just be completely overwhelmed by all the products, all the fluorescent lights, and I would just have to leave because I get such a bad headache. And then on top of that, you get that diagnosis, you get so overwhelmed in these social settings. Obviously, you develop anxiety, you develop depression, and I've been diagnosed with major depression before. Thankfully, I've always had a positive outlook, and I know there's always a light at the tunnel. But it can get pretty dark sometimes when you've been told by very high-end doctors that we don't really know what to do with you. And I've dealt with that, and then about 18 months ago I got diagnosed with bipolar. I'm a very creative person, and if you look at a lot of creative people in the spotlight, anybody from Frank Sinatra to Kanye West, they all have been diagnosed with bipolar. And I did get diagnosed with bipolar 18 months ago, and it's interesting because since working with you, I haven't had any symptoms of bipolar, and I actually have multiple psychiatrists and multiple therapists that I've worked with, and my psychiatrist told me, I think this might be a misdiagnosis. And maybe it wasn't a mixed diagnosis, but with depression or any mental illness, there's a lot of science that shows it's really just inflammation in the brain, and if you can't control that, it's only going to get worse. And so obviously, mental illness is something that is very misunderstood and not understood in a lot of ways, and it obviously has a heavy stigma. If you say you have bipolar, people write you off, you're a crazy person. But what's amazing is since working with you, I've actually, spoken with at least 4 doctors, and they've told me, this bipolar diagnosis was a misdiagnosis, and you don't have to take any medicine for that. And so, unfortunately, there's certain medications you take when you get diagnosed with bipolar, and I've always been a healthy guy, skinny guy. I've always worked out, done yoga my whole life since this injury, and I've stopped taking medication. I actually gained over 50 pounds, and just for confidence level, it's not great to be a skinny guy and then all of a sudden within 6 months blow up 50 pounds. And so I stopped taking that medication because my psychiatrist said, you've been stable for over a year, and I've lost a lot of weight. I work out 5 days a week. I do a steam bath and sauna almost every day. I take ice baths, cold showers, and it's really been wonderful. And I have worked with this therapist for over a year. I've had other therapists that I've worked with throughout the year. It's just through depression and everything that I've gone through, because you go through trauma in life, whether it's through this specifically or just other events with people, and it's good to have someone to talk to. But about a month ago, my therapist we set certain goals at the beginning of our the beginning of working with her, right?
For sure, yeah.
And she goes to me, she's like, John, your life is really wonderful right now, and every goal that we've set together, you've met, and you've exceeded that, and I'm always here for you, but I don't think you really need to work with me anymore. And
that's amazing.
It's a beautiful feeling. I'm young, I'm 27. I've been dealing with this since I've been 16, and it's a scary thing, because you get diagnosed with something like bipolar, and you read about it, and it's this lifelong journey. Nobody knows what that really is. You're scared you're gonna have an episode of some sort or whatever. And I really, my life has been stable for the past 18 months, and my life has been really wonderful, and I've been extremely fortunate and grateful and just happy. My relationships are wonderful with my friends and the people I associate with. And
okay, I just wanted to interject one thing, is that you understand the diagnosis could have been correct. And the reason, what it is there's certain, normally if you're diagnosed with bipolar, whether it's bipolar schizophrenia, obsessive compulsive, in a lot of, not so much depression, but some of these other diagnoses, it's almost as if you're going to have it the rest of your life and you can just control it. You can just control it. You take this medication, you get therapy, you do all this. So part of why I wanted you to speak was that I can't say the diagnosis was correct or incorrect, but you got to realize, if multiple psychiatrists or therapists say that you have bipolar, probably the diagnosis was actually correct. They're just not used to somebody who it appears like it's resolved. Now, you and I don't know a year from now, 2 years from now, 3 years from now,
you never know.
Clearly right now it's resolved. So it's possible that you got your cervical destructure corrected, or it's majorly in the process of getting it corrected, the instability, the curve. And then all of a sudden your brain physiology, if you did a functional MRI before and after, which of course we didn't, but it might be that the brain functioning is just totally improved. And then we haven't even talked about your vagus nerve, because when you first came in, your vagus nerve on the right, because your major compression was in the right carotid sheath, the vagus nerve diameter was very, very low. And then we just checked you now 4 or 5 months after you started, and now it's 90-some% of normal. Because we haven't even talked about that, because the vagus nerve, it calms you down. We haven't even talked about the vagus nerve is regenerating in you, so that probably improved your digestive function, maybe your swallowing. was there other things like your vision or concentration, that other things that improved that you haven't even talked about?
Yeah, so I'd say my cognitive function, like, I know my baseline because I went to school and I excelled at school, and I'm someone that likes to learn and process information. I read every day, and there was a period of time before I came to see you that all I could really do is sit on the couch and watch TV.
Were you working or no?
I was working, but my work
Part-time?
full-time,
Oh, you
but
were, okay.
I was working full-time, but my performance at work was certainly not great.
Yes, sir.
And I'm fortunate to have people in my life that believe in me and support me, and I do have creative talents, and what I do is I'm a photographer, and I take those images and I help grow businesses with them.
Okay.
And drive sales, right? And so that was fine, things were going well, but since doing this treatment, my cognitive abilities have improved significantly. My memory recall has improved significantly, and also, how we all have stories and memories we go through in life, and I'll be working out in the gym and I'll just have a memory that I haven't thought about in
Awesome.
a while that is just like, wow, like I can't believe that happened, or I went through that, and like really beautiful things, and
Awesome.
that sometimes you just forget about. And it's for everything from cognitive function to happiness to just finding peace with that, because
Hopeful about the future.
yeah, and like I'm a strong believer in the law of positivity and having faith. It doesn't even have to be a religious thing, but it's just faith that life will work out, and what needs to come to you will, and people show up in your life, and that's great. And as long as they're adding value to you, you just
That's awesome.
keep them in your life. And I've been able to create a wonderful life for myself in Maine. I live there now, and I fly down to Florida to get these treatments, and it's it seems like, oh wow, like you have to travel I don't know, 1,000+ miles, whatever it might be, I don't know. But at the end of the day, there's no price you can put on your health. And yeah.
I'm sure the video, Jonathan, just want to thank you for making the video, and you were very eloquent, and just we're so happy for you. And I'm sure the video is going to help so many people, especially those who suffer from depression, anxiety, bipolar, and other disorders, like psychological disorders. And obviously there are other causes for those things. We're just talking about the structural cause. And then what would you say for somebody who thinks like it might be a structural cause? They should maybe come down here, get tested. And
yeah, what I would say is the world we live in today, we're all sitting down at computers or desks and staring at our phone, and you really got to take care of your body. And I do hot yoga all the time. I work out 5 days a week, and I think if you don't have your body aligned, you really are affecting other aspects of your life. And just being able to have the right amount of oxygen and blood flow in your brain, it's amazing how much more energy I have. And right now I don't take any medication outside of I take like theanine and magnesium and melatonin to help me sleep, but other than that, like my stimulant of choice is coffee, and
that's awesome.
That's it. So I think I've certainly been in very dark places in my life, and a lot of doctors are quick to say, okay, here's a depression medication, here's an anxiety medication, here's a pain medication. And for me too, I had this condition called allodynia, which is hypersensitivity of the nervous system. And because of how many head injuries I've had, there was a point in time if someone tapped me on the shoulder, it would radiate down my spine and into my brain, and it would feel like I had another concussion off a gentle tap. Like I mean, my father knows this, but back when things were really bad, I'd go to family interactions or family parties, meetings, whatever it was, and my cousins, friends would hug me, and I'd have to go sit in the car for a little while, take a break. And I think we all go through different health problems. Everybody will at some point, and just the most important thing is have hope. There's a solution for almost anything, and if even if it's something terminal, there's philosophies and ways to look at life that can at least ease that emotional pain that actually ultimately affects your physical pain. Because I would say, for me, when I have severe emotional stress, all of my pain gets exacerbated. And there's a lot of studies that show, if you can clear up your emotional instability or your mental health problems, that physical pain you're experiencing will actually be much reduced. So
yeah, and then I think you're a good example of not giving up. So it doesn't mean Caring Medical has all the answers, but there are times where you just gotta search. You just gotta keep searching, and there are times where you gotta maybe try another physician or another facility. So we're just grateful for you sharing your testimony with us. And can I just prove that your allodynia is better by giving you a hug? Is it okay?
Yeah.
Okay.
Yeah. Let's give each
So
other
then
a hug.
we'll, that must feel really good. Just to, and again, thank you so much.
Yeah. Absolutely.
Thank you, my brother.
Thank you so
You
much.
got to get your next treatment though.
Yeah, we got to do the treatment. But